For many women, the arrival of a migraine isn't random. It follows a predictable pattern tied to their menstrual cycle. These are known as menstrual migraines or hormone headaches, and they can be more severe and harder to treat than typical migraines. Understanding how hormonal changes influence migraine can help you recognize symptoms early and manage them effectively. In this video, we'll explore what menstrual migraines are, why they happen, and the best strategies to find relief. What is a period headache? Period headaches are a common form of migraine that typically occur in relation to the menstrual cycle. These headaches are triggered by fluctuations in hormone levels, particularly estrogen. A period headache often presents as pain on one side of the head. The discomfort may worsen with physical movement or exposure to light, strong smells, or sounds. Symptoms can last from several hours to multiple days. Healthcare providers may refer to period headaches by various terms, including menstrual migraines or menstrually related migraines. Hormone headaches, also called hormonal headaches or hormonally related headaches. Period migraines. Hormonal migraines. The connection between hormones and headaches. Period headaches are closely linked to changes in estrogen levels. Specifically, estrogen levels decline sharply just before menstruation begins. Premenstrual migraines tend to occur during or shortly after this drop, when both estrogen and progesterone reach their lowest levels. These significant hormonal fluctuations play a key role in triggering headache episodes. What does a hormone headache feel like? Hormone headaches related to the menstrual cycle are often more intense than other types of headaches. Many patients describe the pain as pulsing or throbbing, and it may be accompanied by other uncomfortable symptoms. How common are period headaches? Migraines affect approximately 12% of the American population. Among individuals who menstruate and experience migraines, at least 60% report that their migraines occur in connection with their menstrual cycle. What are the symptoms of a period headache? Symptoms of menstrual migraines can vary, but commonly include head pain ranging from mild and dull to severe and throbbing, increased sensitivity to light, sound, and odors, tenderness or soreness of the scalp, loss of appetite, dizziness, blurred vision, fatigue or feeling unusually tired, nausea and vomiting, along with upset stomach or abdominal discomfort, episodes of sweating or chills. Where is the pain located during a menstrual headache? The pain associated with a period headache typically affects one side of the head. It is often felt around the forehead but can occur in other areas or shift from one location to another. The experience may differ between individuals. When do period headaches usually begin? Menstrual migraines can start up to 2 days before the onset of menstruation and may continue for up to 3 days during the period. Why do I get headaches with my period? Period headaches are caused by changes in hormone levels, primarily estrogen. Estrogen is one of the main female sex hormones, and its levels fluctuate throughout the menstrual cycle. Estrogen reaches its peak around the middle of the cycle and drops to its lowest point during menstruation. This sudden decrease in estrogen increases pain sensitivity, making headaches more likely to occur during your period. What triggers period headaches? Hormonal fluctuations, especially changes in estrogen, are the primary triggers of period headaches. Additionally, certain medications that influence hormone levels can increase the frequency or severity of these headaches. These include birth control pills, hormone replacement therapy. If you notice worsening migraines after starting these medications, it is important to discuss this with your healthcare provider. They may suggest a different medication with a lower estrogen dose or recommend a continuous dosing schedule instead of an interrupted one to help reduce symptoms. What are the risk factors for period headaches? If you menstruate, you are naturally at risk for menstrual headaches. Other factors that increase this risk include having migraines outside of your menstrual cycle, a family history of migraines indicating a genetic predisposition. What are the complications of period headaches? Period headaches can disrupt daily life, affecting your ability to participate fully in regular activities. Although you may be able to predict when these headaches will occur, The anticipation and planning around these episodes can interfere with your routine and overall quality of life. Working with a healthcare provider can help you develop effective strategies to manage menstrual headaches and minimize their impact. How is a period headache diagnosed? A healthcare provider diagnoses a period headache through a thorough examination and by ruling out other conditions that may cause similar symptoms. During the evaluation, your provider will ask detailed questions about your migraine symptoms, including: can you describe the severity and location of your pain? Is the pain pounding, pulsing, or throbbing? How often do you experience migraine headaches? Are there factors that make the headache better or worse? What medications do you use to relieve the pain, and how frequently do you take them? Are there specific activities, foods, stressors, or situations that seem to trigger the migraines? Does anyone in your family have a history of migraine headaches? How do you feel before, during, and after the headache? To rule out other potential causes, your healthcare provider may order blood tests or imaging studies, such as a CT scan or MRI. The importance of a migraine journal. Keeping a migraine journal can be very helpful for both you and your healthcare provider. Document your headache symptoms, their duration, and any factors that seem to improve or worsen your menstrual migraines. This record provides valuable insight for diagnosis and treatment planning. Should you see a specialist for period headaches? If you experience regular headaches around your menstrual cycle, begin by consulting your primary care physician. If necessary, they may refer you to a headache specialist for more specialized evaluation and care. How are period headaches treated? Medications are typically the primary approach to managing menstrual migraines. A healthcare provider may recommend several options based on your symptoms and medical history, including oral birth control pills. If you are currently using oral contraceptives, your provider might adjust the type or dosage to reduce the hormonal fluctuations that trigger headaches around your period. Non-steroidal anti-inflammatory drugs. NSAIDs help reduce pain and inflammation. They are often recommended to start 2 to 3 days before your period begins and to continue through your menstrual flow. Triptans. These selective serotonin receptor agonists are commonly used to treat migraines. Triptans can be taken at the onset of symptoms to stop headache pain. They are available in oral tablets, injections, or nasal sprays. Hormone therapy. Estrogen supplements can help regulate hormonal changes during your menstrual cycle. These may be prescribed as oral medications, vaginal gels, or patches to be used during the week of your period. Medications for severe menstrual migraines. For more severe cases, your healthcare provider may recommend anti-seizure medications, such as topiramate or valproate, antidepressants, including amitriptyline or venlafaxine, antihypertensives, such as propranolol or candesartan. Other possible medications include metoclopramide, calcitonin gene-related peptide, CGRP, antagonists, and dihydroergotamine. Supplements that may help. Your provider might also suggest supplements like magnesium oxide 400 mg at bedtime, riboflavin 200 mg twice daily, coenzyme Q10 300 mg in the morning. Medication management. Often, a healthcare provider will try different medications or combinations to determine the most effective treatment. Consistency is important. These medications generally work best when taken on a regular schedule. Your provider will guide you on the optimal timing for medication use to prevent or manage your symptoms effectively. Managing period headaches without medications. Some natural approaches may also help ease period headaches, though it may require some trial and error to find what works best for you. For example, if light worsens your headache or you feel overheated, resting in a cool, dark room can provide relief. Additional lifestyle tips include getting adequate sleep, eating balanced meals on a regular schedule without skipping meals, engaging in regular physical activity, practicing stress management techniques. Can a period headache be prevented? A healthcare provider can assist you in managing and preventing period headaches. While it is not always possible to prevent every headache, your provider may recommend preventive medications that you take daily. Often, the dosage of these medications is increased as you approach your menstrual period to provide better protection. It is important to discuss preventive treatment options with your healthcare provider. They can help develop a personalized treatment schedule tailored to your needs, aiming to reduce the frequency and severity of menstrual migraines. Menstrual migraines affect many women and can significantly impact quality of life. But with the right knowledge and treatment plan, these hormone-related headaches can be managed successfully. If you suspect your migraines are linked to your menstrual cycle, speak with your healthcare provider about tailored prevention and treatment options. For more trusted medical information and tips, subscribe to our channel and check out the resources in the description below. Thank you for watching and take care of your health.